Good afternoon, everyone, and welcome back to our Facebook Live. My name is Gabby, and I am joined here today with Connie. How are you, Connie?
I'm great.
Great.
Glad to be here.
Awesome. Well, it's great to have you on. We're going to talk a little bit more about Connie's job with Boys Town, as well as some points on mental health and Boys Town's services for that. So if you have a question for Connie or about mental health as it relates to Boys Town, please leave it in the comments section of this video and we can get it answered at the end. Otherwise, let's hop right in. So Connie, if you would please begin by introducing yourself, tell us more about you and your role at Boys Town, that would be wonderful.
So, my name's Connie Schnoes. I am a psychologist. I work in the Center for Behavioral Health. I work with children and families of all ages with all kinds of concerns. I'm also a supervisor in our training program for doctoral level psychologists, and I am the director of our National Behavioral Health. We have clinics in 5 other sites nationwide, and I oversee those clinics as well.
Very nice. So, what made you interested in becoming a psychologist and working with children and families?
Boy, that goes all the way back to undergrad, Gabby.
Yeah.
I thought I was going to be a teacher,
Hmm.
and I got some exposure to psychology and helping kids with very specific needs. And I thought, that's what I want to do. I want to help kids with more specific needs beyond being a classroom teacher. I have great respect for classroom teachers. My mom was a teacher, my husband, my daughter, my son in law, they're all teachers. That's a hard job. I
Yeah.
just wanted a very different kind of job.
Yeah. That's awesome. So, you've served youth and families for over 25 years. That is amazing. Could you tell us more about how your career began after school and how you've grown into the leader you are today?
Sure. I did go straight from undergrad into graduate school and got a master's degree in counseling psychology. However, I did not do a very traditional path after that.
Yeah.
I ended up working in the world of treatment foster care in West Virginia for a well known organization by the name of Presley Ridge Schools.
Hmm.
I then came back to Boys Town, came home to Nebraska because that's where I'm from, and helped launch Boys Town's foster care program back in the late 80s. Worked at Boys Town till about the 94 and shifted from foster care into consulting to inpatient psychiatric hospitals
Hmm.
and their treatment planning. It was a very different world than it is today. In the early 90s, late 80s, early 90s, kids could be in an inpatient psychiatric hospital for a year, months and months and months, in a year or more. And so bringing a treatment model to that setting was important. But then managed care came in, and now that inpatient stay is maybe 2 weeks. And so it was not near as long a length of stay as it was that decade ago.
I'm so sorry. My dog is barking. There's a
No
dog outside my
goodness.
window. I'm so sorry. He can definitely hear it, so I apologize.
That's good to know it's a dog.
Yeah.
So,
So, growing up in Omaha, were you always familiar with Boys Town?
well, I didn't grow up in Omaha. I grew up in a little town out on a farm outside a little town called Dodge, Nebraska,
Okay.
about an hour away. And I was aware of Boys Town. We used to drive past Boys Town like once a year when we came into Omaha, and it was out in the middle of nowhere. Didn't really know what it was. And to be honest, at the time we moved to West Virginia, we had applied to be essentially a family teaching couple at an organization in Florida and had no awareness that Boys Town had the same thing.
Yeah.
Like
Wow.
until 1988, when we moved back home and were working for Boys Town, I was like, oh my gosh, we could have done this right here.
Right.
But clearly not the path we were supposed to be on. So I ended up, after being at Boys Town and doing that work, and managed care took over. We started the inpatient program at St. Joe's Hospital in Omaha,
Mhm.
and we that was my site. And we also started the RTC there in the early 90s. And then things happened in the ownership of St. Joe's, so that all shifted, and we kept the RTC, and that provided me with an opportunity to go back to grad school, something I always knew I wanted to do to get my doctorate. And so I went back to grad school at UNL and got my doctorate in school psych. And pursued licensure and came back to Boys Town in 2007 as a psychologist doing the work that I do, plus everything else that I do now. So,
Okay, so speaking of 25 years, in 2019, the Boys Town Behavioral Health Center celebrated its 25th anniversary, now coming up on the 28th anniversary. So, how has this center grown over time?
oh, it's grown a ton. When Boys Town first started working with doctoral psychologists in training them as interns, which is their last requirement, year-long training before they can graduate with their doctoral degree. Back in 1994, they were very focused on research and further learning and development, very limited clinical services to campus. Since then, now the vast majority of their clinical work is to kids on campus. So it allows Boys Town the opportunity to have direct services for kids that are going to support and be complementary of the model and allow for better communication and coordination of care. In the last few years, we've added more interns to the training program, and there's such a demand for services. We've also increased the number of clients they see that come just from the metro area. So historically research, then campus kids only, now campus kids and metro area kids and more. We've also expanded that training program to our behavioral health clinic in Grand Island, and we have interns in Grand Island and a postdoc out there as well. And we've expanded the idea of training nationwide to all of our national sites from a postdoc perspective in all of our sites. So all of our sites now have postdocs in place or will shortly. In our Nevada site, the opportunity to do an internship there is not there, but to train doctoral students as externs, which is prior to going on internship, is there. And so our Nevada site has taken that on as well. So Boys Town just continues to prioritize training at the doctoral level. The best way for us to provide the services we provide nationwide is to have good psychologists. And the best way for us to get good psychologists, or one of the best ways, because we have several psychologists we did not train, but one of the best ways to do that is to train them and find folks who want to stay with us, whether it's in Omaha or anywhere else in the country, which is
Yeah,
working out beautifully.
that's so awesome. Great. So, for our followers who maybe aren't so familiar with Boys Town Behavioral Health, can you describe the kind of life saving work that is done there?
We do so many things to help so many children and families. It might be something we might think of it, people might think of it as simple, but in the lives of the families who come to us, when they come to us, they really are hurting and desperate for services. One of the things that I love to do is work with sleep problems. And it doesn't typically take too long to help families and children get that handled, but the impact it makes in their world. Sleep deprived people are very unhappy. Sleep deprived parents, it's very hard to be a parent when you're sleep deprived. And so helping everyone get better sleep, including the kids, so that they can have healthy functioning, optimal growth, all of that. And that's just as true with anxiety or depressed mood or dealing with multiple tantrums and helping that improve. When you think about life saving, my head goes more literal, like suicide prevention and self harm and hopelessness. I mean, we really do deal with all of it. But life saving can also be the social skills groups that we offer kids to just help them make friends and keep friends. So they they enjoy life and they want to be in life. So just all sorts of individual and family therapy services, group services for folks who need help.
Yeah. So, you mentioned just a little bit ago that sleep is one of your main focuses. Why is this of particular interest to you?
I came upon it kind of serendipitously. Um, I happen to have 6 children. My husband and I have 6 children. And when I was in graduate school, I visited campus. I visited Dr. Fryman's department. He was having a training meeting with those interns one year, 1996, I think, or 97. And he was talking about sleep. He was training to sleep, and he was talking about an intervention that he had tried multiple times, thought it worked pretty good, but didn't have any real data, and said if anybody wants to collect data, he'd be happy to have someone do that. And he was talking to his interns, but I was in the room. And so after that meeting, I reached out to him and I asked if I could do the research. At that point, our kids were pretty little, and I was convinced as the mom that all 6 of them had sleep problems. And the intervention was called the bedtime pass. And so I ended up using that intervention for one of my graduate classes, a research class that I was in at the time, and it worked like a charm. And it also, we published it, got lots of national attention, which just increased my awareness of just how impactful sleep problems in children is for families and children. My internship at the Monroe Meyer Institute was with Brett Kuhn, who's a very well-known expert in the field of pediatric sleep medicine. And I wanted to work with him specifically because I wanted more exposure in sleep. And so I have just taken that on since that day. Like that has just been something I truly love. It really can bring quick, impactful outcomes for families. Just be so extremely helpful.
Yeah, that's awesome. So if you're watching out there and your child has sleep problems, you know who to go to.
Mhm. I really do love working with them. I love it. All ages. Yep.
That's awesome. So we just have a couple more questions here for Connie. So if you're watching live and you have a question, please leave it in the comments below. And make sure you like this video. So this is a loaded question, kind of a big one here.
Okay.
How do you think Boys Town stands out as a leader in mental health care?
Oh, that's not even really very loaded. We stand out in a couple of different ways. One is as we do the work we do, one of our priorities is behavioral pediatrics, and that is helping families with those very common problems that they report to their pediatricians almost half of the visits they go that pediatricians see on a daily basis. It's behavior problems. And that's not what pediatricians go into medicine for. And so we are eager and willing and well trained to help families and pediatricians with all of those kinds of issues: toileting, feeding, sleeping, behavior, attention, emotion regulation, just all of it. So in that regard, very much a leader. As we go out and replicate what we do across the country and our folks go out to meet with pediatricians and explain what we do, they've never met anybody like us. And they are so appreciative of that service and that we have the skill set to do that. We also deal with other concerns, the anxiety, the depression, elementary age, adolescence. We deal with all of it, but we help families very early on, very efficiently. We're very effective. It doesn't take a lot of appointments. If I'm dealing with a straight up sleep situation, 4 appointments max, and most of the time it's not 4. So we're very efficient. The other thing is, we know as we are out there hiring and looking at opening clinics in different places that there are not a lot of pediatric psychologists to begin with. So that makes us a leader because we have a lot in our organization. But we also are very aware that many of the psychologists out there are opting for private practice and opting to not necessarily panel with very many insurance companies, if any. And so we at Boys Town, we're very determined and committed to help children and families. And so we panel broadly with insurance companies so that families have access to us instead of making it more inaccessible to them. So that would be another way we are leaders. We are also very well trained and come from behaviorally oriented backgrounds largely, and using evidence-based practices we know are going to have an impact and be helpful, like we just do. Our other, along with that behavioral pediatrics is we're very committed to working with pediatricians and collaborative care if our clients consent to that. And so facilitating that treatment process and having everybody working together is very much part of what we want to do as well. So one more example would be as we establish those pediatric relationships, we're also very committed to providing services in pediatric locations. And so we talk to pediatricians about what we can do. We prove ourselves first if we need to. And we let them know we're available to be on site in your clinic to help make that more accessible to your children and families that you're serving. And we do that without being any sort of burden or effort on the part of that practice. And that's something we're committed to nationwide as well.
Awesome. That was a great explanation. So I have one more question for you before I ask it. I want to let everyone know that I will make sure to link in the comment section of this video more information on our behavioral health clinic and our services, so you were able to look through those after this live concludes. Okay, Connie, so I have to bring this up and mention you. You were recently nominated as an honoree by the Women's Center for Advancement for the 35th Annual Tribute to Women Lunch in Omaha. Congratulations. That is so awesome. Can you tell us more about that?
So the Women's Center for Advancement helps children and families and women who are in need. Many times there's domestic violence involved or homelessness or whatever, but they help children and families in need. Each year, women are nominated for this award. I understand, I think 24 or 30 women were nominated this year. I don't actually remember that number. And I was very surprised that I was selected as one of the nominees. And so it's just trying to acknowledge, it's an award that acknowledges the effort of women to support children, young girls, and women. And I touched some lives of people who thought it was important and made that nomination. So I was very honored, and it was quite the experience.
Yes, that's so wonderful, and I can even hear your humility within this live. So congratulations, that's a great accomplishment.
Thank you.
Yes.
Thank you.
Well, thank you everybody for watching. I hope you got to learn more about Dr. Schnoes and her role at Boys Town, as well as about the Behavioral Health Center. So if you have any other employees at Boys Town that you know that you think would be worth spotlighting, comment below and let me know. I'd love to build on this series and interview some more. We did interview Father Stephen Bays last week for Donor Week, so if you missed that, it is on our Facebook page and you can go watch that. So thank you all so much, and I hope you have a great rest of your afternoon. Bye, Connie.
Bye, Gabby. Thank you.
You're welcome.